so I'll be talking about why people should know about seizures and how to take care of them and being able to recognize the symptoms. So about a year ago, we were at a softball tournament, and my team was actually playing, and I was sitting on the bench icing my knee because I got hurt. But all of a sudden, the crowd started getting really rowdy, and someone shouted for help. So I ran over to go see what had happened. And when I got over there, I found my dad laying on the ground, and he had blood on his face because he had fallen whenever he had a seizure and hit his head against the brick wall, and he was just laying there, and his mouth was foaming. And like all I could do was stand there and look terrified and like a deer in headlights because I had no idea how to help him. So that's basically what inspired this, and like why people should know how to help someone having a seizure, because it's almost as common as someone drowning. Like 10% of Americans in their life will have a seizure, whether it be once or having a brain injury that caused them eventually, or having epilepsy. So 1 in 26 Americans have epilepsy, and it's not the only reason people have seizures, but it's definitely like the most commonly known, and the signs are the most easily recognized because it causes convulsions and twitching, where some seizures it's just people like spacing out and not knowing where they are and having like out of body experiences, and it's unexplainable, but they're still considered seizures. So there are 4 signs that most epilepsy foundations will agree with that are similar for all seizures. So they're unpredictable. So even if you have epilepsy, like I know one girl that has epilepsy, and she has 1 seizure every month. She knows that she's always going to get it during a month, but she never knows when it's coming on. So like in June, she had it while we were at camp, while we were getting ready for dinner. Like she had no way of knowing that that was going to happen. The next is they're episodic. So they come and go. So you can be regular, like the girl that has it once a month, or you can be someone that has it once a year, or like my dad who just had one and hasn't had one since. Next is they're brief. So they usually last a couple of seconds to a couple of minutes. And if they last over 3 minutes, that's when you're getting into the dangerous zone, because they're called grand mal seizures, and it can cause more brain damage, especially if you've already had a stroke or a brain tumor or any like head trauma. And the last thing they usually agree on is they're stereotypic. So if you're epileptic, you know that you're going to have convulsions and you're going to be twitching. Or if you have brain trauma, the same thing. You usually have the exact same symptoms every time you have a seizure. And if you have the mild seizures, you will hardly ever have the convulsions or twitching. You'll just have the out-of-body experience. So the first thing that so causes of seizures. So I mentioned epilepsy, brain tumor, brain trauma, and this is just a list of the rest of the known causes of seizures. There's over 40 of them, and this is the most commonly known. Other things that can cause it are heat illness, like being out on a softball field too long and just overexerting yourself. Fever can cause it, just so electrolytes in your brain just not agreeing with each other and causing a seizure. So the first thing that people should be educated about is signs of the seizure. So signs of the seizure, if they're mild seizures, you'll see people space out or not be able to focus on something, and their eyes will like face forward and not be able to focus on anything at all. And so like they'll hold completely still, and their body can go pale or almost blue because their mind isn't agreeing with their heart, so their blood starts pumping slower. And then obviously if you have like epilepsy, it's convulsions and falling and twitching. The next thing people should know are what to do when someone has a seizure. So these are 8 steps that you should follow when someone has a seizure. The first is you should immediately start timing when you notice that someone has a seizure, because a doctor needs to know about it, or if they have to be transferred in an ambulance, they need to know about it because they need to be able to recognize what type of seizure it is. The second is lay them down as gently as you can if they haven't already fallen. So if they're in a chair, they have to be laid down, because whenever someone starts having a seizure, they're not able to swallow. So you have to be able to drain any vomit or saliva that's coming out of their mouth. The third is move any furniture away from them. This is more for people that have convulsions and twitching, and it's so that they don't catch anything or bruise themselves worse than they already have if they've fallen. The next is turn onto their side. That's to alleviate head, which is the fifth one is to cushion their head, is to alleviate their head a little bit. Also to drain the spit and make them more comfortable. The sixth one is loosen any tight clothing. So this isn't absolutely necessary when someone is having a seizure, because if someone's moving around a lot, like loosening right here or right here can be really hard. But as soon as they start moving less, it's extremely important so that they can start breathing better. The seventh step is look for a medical ID tag. So like my dad has a dog tag, and it usually indicates if they have epilepsy or if they've had, in my dad's case, if he's had a stroke, and it will tell doctors like what they need to know so they know what kind of seizure they're having. And the last one is stay with the person until they're all like completely awake. So generally when someone is having like convulsion seizures, a good thing to do is lay down next to them whenever they start calming down and start calling their name and just talking to them, and it can help them get out of their seizure, not necessarily more quickly, but easier and less embarrassed, because they're really embarrassed, especially people with epilepsy. They're afraid to go out in public. The next thing people need to know is what not to do. So what people generally know about seizures is what they've seen on TV, and the majority of it isn't correct. So the first thing, don't put anything in their mouth. So a lot of seizure people bite their tongue, and people think that you can put like a leather belt or a pole in their mouth, so that can cause worse damage and cause them to break their teeth or dislocate their jaws or start choking on what you put in their mouth, and it's not something you should do even though it's shown on TV. The next, don't restrain the person at all. People try to do this because they can be in they think in a dangerous situation by being close to an item, but restraining them can cause them to dislocate their shoulder or get burns or bruising, and it can cause worse damage than what their TV would do. The next is try not to move the person unless absolutely necessary. So if they're at the top of the stairs, or if they've fallen on the stairs, or if they're next to a pool, then that's a situation where you absolutely need to move them, because they could end up falling and hurting themselves worse. But if it's not that, then just leave them where they are and try to keep them in a safe position. Next is don't restrict convulsing. The person doesn't know what they're doing with their body. They have no connection to their mind whenever they're having a seizure. So you trying to control them will cause them to, one, hurt themselves again, but like it'll make them feel more uncomfortable whenever they come out of their seizure with the feeling of having something wrapped around them or restraining them. They'll probably freak out more when they come out of it. And the last thing is don't give anyone having a seizure CPR. So this is generally in the milder seizure cases when people are zoning out and it looks like people aren't breathing, or they get super pale and they have a really light pulse and their pulse may stop. And so in this situation, what you need to do is wait completely and see if you can get their eyes to focus. And if that doesn't happen, then you can start giving them CPR. And the next thing people need to know is when to call for medical assistance. So in most cases of seizures, you don't need to call for medical assistance. They're generally capable of being handled by normal people. Cases to call are if someone's pregnant, absolutely call no matter how long it's been. If it's lasted over 3 minutes, or if a medical ID tag identifies that they've had brain trauma before. And so basically, people need to know about seizures because they are common and it could happen at any moment. And if someone were to fall down and someone didn't know how to help someone with a seizure, they could end up injuring themselves worse, or someone could decide not to call an EMS because they just don't know how to handle it, and that person could end up dying of more brain injury from if they have like a grand mal seizure. So educating about seizures is super easy, just like these 8 steps that I found to be able to handle a seizure. That's found online, and it's easier than teaching CPR to a person, and you don't have to be certified. But if it was taught in a regular classroom, then injuries during a seizure would be less significant, and people would have a more comfortable situation in epilepsy, and people that have regular seizures, they wouldn't feel uncomfortable to go out in public.
Awesome, good job.